And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levin. And we always talk about pregnancy and things that you can and cannot take. And acetaminophen, obviously one of those medications that you probably need to stay away from.
Yeah, just talk with the obstetrician. Normally they have a list of do's and don'ts when you become pregnant. Certainly the fetus is a major priority, and it just reiterates the understanding that whatever you put in your mouth can impact your body, and in particular fetus, so you always want to be cognizant and aware of that. But just work intimately with the obstetrician to decide if it's good or not so good for you. You know, mothers can get sick while they are pregnant, and unfortunately we sometimes are forced to use some of those medications. We just have to be aware of the potential for side effect and complications. Try to use low-risk medications, low-risk procedures while protecting the fetus. But sometimes you have to do what you have to do. Just talk with the obstetrician.
All right, on to some of our viewers' medical questions. This person says they have a 5-month-old who has had a loose cough for about 2 weeks now. His pediatrician put him on breathing treatments and antibiotics. Nothing has changed, though. Any advice on what else to do?
Yeah, probably, get back with the pediatrician. As I've tried to, reinforce in the show, sometimes we don't always have the right diagnosis. We have to change the medication. We have to change our diagnosis. Maybe do a chest x-ray, maybe give a different antibiotic or more breathing treatments. So I'd probably get back with that pediatrician.
Okay, another question. What does it mean if you've had the flu and now it's an upper respiratory infection? It's been present since January.
Yeah, upper respiratory infection is kind of a blanket terminology physicians use to indicate any type of infection of the upper respiratory tract. So it could be the flu, it could be a bacterial infection, could be a fungal infection. It is all an upper respiratory infection. The flu is a specific type viral, typically of the upper respiratory tract. So theoretically you could have the flu, 2 weeks later you could have a bacterial infection, and the physician would call those both an upper respiratory infection. So
do you treat them the same?
No, absolutely not. You treat the flu with antiviral medications. Tamiflu is the one we use a lot, as well as the bacterial infection. We treat those with antibiotics. Everybody loves those antibiotics, Augmentin, Tamiflu, Augmentin, Z-Pak, among others.
Okay. Does your thyroid affect your heart, and does it cause one to have a heart attack?
Potentially, yes. The thyroid is kind of a little chemical that is responsible for a lot of our chemical reactions. So depending on if it's high or if it's low, theoretically it could potentially eventually lead to some heart disease like a heart attack, but typically not initially.
Okay. Is there anything that can be done for pain when it causes endometriosis?
Well, a lot of times, sometimes surgery is necessary for that. We always try and start off with anti-inflammatory medications, Tylenol or acetaminophen. Tramadol is a moderate potency pain medication. But typically, if the medicine stopped working, that's normally when we turn to surgery, and you just have to work with your gynecologist to determine when the best time for that is.
Can you live with endometriosis indefinitely?
I think you can. I don't do gynecology all the time. Just my current understanding is, if it's mild, probably you can live with it. But as what I know, patients typically have a lot of abdominal pain. It's uncomfortable. It impacts your lifestyle, and typically something more aggressive needs to happen, whether it be a surgical, laser procedure, etc. I'm not quite up to date on the latest guidelines with treatment of endometriosis, but that typically is some generalizations.
All right. We've got lots of other questions. We'll get to those in just
Yes,
a minute.
ma'am.
So don't go away. Dr. Levin will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levin to answer more of your medical questions. A 73-year-old female was diagnosed with symptomatic lupus 2 years ago, but she doesn't know if she needs treatment. Is there any treatment that she needs to ask about?
If it's a systematic lupus, certainly lupus can affect any organ. It is an autoimmune disease, inflammatory in nature, so it can attack the heart, the skin, the brain. So normally if you have symptoms, that typically dictates whether or not we treat it. So if the patient has no symptoms, but the blood work is maybe showing they have lupus, we might observe them off of medication. So symptoms, treatment is normally how we address that.
Okay. Another person, I had knee replacement surgery and my knee still hurts. It feels tight. Should she do anything else?
Yeah, again, get back with the orthopedist who performed the procedure, see what the results are. Maybe there's some other things that can be done, physical therapy, anti-inflammatory medications, another procedure maybe. Maybe they saw something they need to redo. So always get back with the surgeon in that situation.
A 51-year-old female, what causes someone's intestines to rupture to a point where someone would die?
A lot of times the intestines twists on themselves, and a lot of times that reduces blood flow, and basically a hole develops. Sometimes an ulcer, like a peptic ulcer disease, can cause a rupture in the stomach a lot of times. So those are the two most common types. Typically not anything like foreign body, but sometimes we do see that. If you swallow something that's sharp, it can puncture the intestines, but typically peptic ulcer and just a blockage of the intestines are the things that we see a lot of times.
Would you know that before it actually happens, or would it just, boom, happen?
For most patients I know, it's normally a very sudden onset of symptoms, just intense shearing, sharp abdominal pain, just you cannot stand, you're basically laying on your side curled up like a baby because it is so painful.
Wow.
And depending on the medical problems you have, your blood pressure might fall, you might lose consciousness. It is a medical emergency.
Okay, another question. This one is a 46-year-old female. She had her teeth taken out in 2001 and she's had headaches ever since. Could it be related?
I don't think so, depending on what she had her teeth taken out for. As you know, we talk about headaches a lot on the show. Migraine is probably the most common. Stress headaches, as well as headaches emanating from the cervical spine, so nothing related to the teeth. But certainly sometimes there can be a connection, but a lot of times the teeth would have to be infected, maybe draining. Maybe I would consider that, but if they've all been removed and her gums look good, probably nothing related to why she had the teeth taken out.
Could be pollen in the air right now.
Well, yeah, you know, there are a lot of triggers in terms of headaches, and so you just have to find out what your triggers are. Certainly get an x-ray of your brain or a CAT scan if you're concerned about any type of malignancy or aneurysm, because we do see those, but they're unlikely.
And when we're talking about the brain, the best person to go visit instead of like your general practitioner is to go directly to a neurologist?
Well, sometimes that's quite difficult. Here locally, you know, their waiting lists are pretty long, and when you're in pain, you need some relief, so a lot of times the primary care physician does know what to do, can get you on some medication, get you started, get that CAT scan, get the blood work, and then long term, certainly if your symptoms are not relieved or you're still not getting the relief you think you need, then certainly you can get to a neurologist. Here locally, like I say, it's just not a lot to go around. Certainly in a bigger city like Houston or Austin, there might be a lot more neurologists you can get in to see within a very short period of time, so maybe in that setting.
All right, Dr. Levin, as always, we appreciate you stopping by. And you can see the answers on our website to these and other medical questions. And if you'd like to have Dr. Levin answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kftm.com, or you can post those questions every Monday on our KFTM News Facebook page.